Perfect. Let me start this one more time. Hello, hello. All right, we're live. We're good. Perfect. So we're on Facebook and we're on YouTube. Hello, everyone. Dr. Rich Castellano here, the Smile Doctor, a Wall Street Journal bestselling author of The Smile Prescription. We are here today with Dr. Lee. Thank you so much for joining our program today. Dr. Lee has so many accomplishments and achievements. I can't fit them all in, but he's a trainer. He's won numerous awards. You're an innovator, an inventor. So thank you so much for joining us today.
Well, thank you, Dr. Rich. I appreciate the offer to come and chit-chat with you. And Dr. Rich and I have met before, and I love his smile. He has the most incredible smile and the personality to match it. I appreciate that.
You're so kind. And it takes one to know one.
Of course.
And we have a lot to smile about.
I think so.
So why not share it?
Sure.
So that being said, now I got to talk about this. You've got your device here.
Sure.
Tell us about what this is. We're at the Aesthetic Show, so we're learning about the latest developments in cosmetic and aesthetic treatment. So what is it? What are we looking at here?
Well, first of all, you're looking at a typical syringe with Juvederm, which is used to fill fillers.
Yes.
And at the tip, we have a micro cannula.
Yes.
But what's particular, if you look closely, see this little purple attachment here?
Yes, I see that.
And one of the problems that we all face when we're injecting cosmetic fillers into wrinkles is that there's a substantial risk for injecting into blood vessels.
Yes.
And if you go into a blood vessel, you can absolutely have a catastrophe.
It's not good news. You want to avoid the blood vessels, absolutely.
And what happens, and what has happened, is people have inadvertently injected and caused necrosis.
Not good.
It caused stroke.
We don't want that.
And there's been
So how does this help prevent?
Well, yeah. Now here's the thing. You know, everybody tells you that you have to aspirate. You have to pull back in the syringe, and when you pull back in the syringe, and you see blood flashing into the tip, you know you're in the blood vessel. Then you go ahead and inject. But what happens is that when you actually try and do it in practice, it's not practical, because if I'm injecting, this is a typical way I inject, and I'm on the board for Allergan and Galderma, and I teach for them.
Amazing.
Teach injection. When I try and inject somebody, one of my hands is this way, one of my hands is this way to hold the skin in place. Now, if I want to aspirate, look what I have to do. I have to stop what I'm doing, grab the tip, I have to release my hold, I have to grab the plunger, and I have to pull it back. And when I pull it back, it actually dislodges the tip of the needle.
Not where you were anymore.
So when you try and advance it, you could actually be injecting into a blood vessel. So that's why most of the experienced injectors don't really aspirate every time. And I said, well, it's crazy. You know, why don't we have something simple where we can pull back with minimal
So that
movement.
holds your thumb and finger. So one-handed, you can pull back.
Now, if you watch here, first thing I did is I looked around and said, well, where is it? And there isn't any.
There's none.
So I'm like you. I said, well, there isn't any. Let me put it together.
He invented it.
And so if you see this purple thing here, this fits in all Juvederm syringes. Now all you have to do is, when you want to pull it back, you just move your thumb.
Now can I try that out? Let me feel that.
Absolutely, go ahead and try it.
I love that. Now this definitely, it feels very easily. I do a lot of injections, so it's definitely easy to really pull back. You know what I do, because some of the syringes only have a small hub depending on the product. I actually do take my finger and just try and push it back here, but it's not as easy. You have to be either very skilled or you won't get as much pressure. This, you got a holster for you, so you can pull that back. Much better control, better safety.
Way better. And here's the thing about it. Of course, you have a technique, you can do it with your hand, but you know, ergonomically, it's painful to keep putting that pressure. And so, you know, when you're
a little massage on my hands.
And you know, when you're treating a patient, the best thing is when you have the best tools and when it's comfortable for you. So you can focus only on the patient, not on your finger. Now, here's the other thing. You can snap it on and off in minutes. I'm going to snap it off here, just like that, and I'm going to pop it out here. And in a matter of seconds, the syringe you're done with, you can replace it and put another one on. And literally, it takes
you seconds.
Just like
that. That fits right. That looks like it's custom made for the Juvederm syringe.
That's correct.
Like it sneaks right in there.
See it right there?
But you can easily enough formulate that to fit on any syringe.
Oh yeah.
Many different types of syringes.
The one that is out in the market now, we call it the Lee aspirator.
The Lee aspirator. I love it. Hey Gabe, thanks for joining.
Okay.
Good to see you.
Hey Gabe, nice to meet you too.
Can I see that? Can you break that off one more time?
Oh sure. Now if you watch, it's very simple. You pop it.
This is what I love about the aesthetic show. You
And
learn new things.
It takes seconds. See that right there?
Now, so let me take a look at this. So I love this for the syringes. Now, can I put this on my cell phone so that I can hold it on my cell phone too? Just kidding. But that's...
It depends on your cell phone. Right?
It depends on your cell phone. So that's wonderful. So thank you so much for sharing that. Now, is it available for purchase yet, or where can they get a hold of these things?
Well, it's actually available right here at the Aesthetic Show.
At the Aesthetic Show.
You go to the Airtight booth. They're the distributor.
Airtight.
Airtight. AIR-TITE. And you can pick it up today. And now another thing that we have that's different. Jen, can you bring our book? It's in my briefcase.
Let's take a look at the book. So, go ahead.
We talk about microcannula. And microcannula look just like needles, but they're not needles because watch, it's not sharp at the tip. It looks like a needle. It's blunt on the tip. It's got a tiny little extrusion port at the tip to place your filler.
Yes.
And and I'm the national trainer for one of the microcannula companies. I teach doctors how to do it. And the advantage is, with the microcannula, we have 80%, in my experience, less bruising, less pain, less swelling, less tenderness. And so the microcannula, in my mind, has revolutionized what we do for
I love the
cosmetic injectable
microcannula.
fillers.
I use them a lot. So what do we have here?
Oh no,
Is this
the other book.
book? Okay,
Yeah,
that's
yeah.
a great book. We got another. We got too many books. We got to figure out. We got a whole library we're going to show you. This is wonderful. While she's getting that, what is it that you love the most about the Aesthetic Show?
It's a funny thing, and I like the energy that's at the Aesthetic. That's it. I like the energy that's at the Aesthetic Show. You go around here.
A lot of great energy here.
Typically you go through and it's all the same thing that you've seen throughout the entire year. At the Aesthetic Show, you have people that are like Dr. Richard at the cutting edge of everything. Hello. And so you get to look at people that are doing things that no man has done or woman has done before.
It's true.
And so now we're looking, and this is how science advances. Science advances not with the on-label. The off-label begins first, and then people like Dr. Rich here and the people that are at the show innovate. And that's how we advance and find the newest devices, the newest safety treatments, the newest ways of regenerating skin.
We learn from one another.
And I learn a lot from my colleagues because otherwise you're just very insular. And here's what the most important thing I learned is that you don't know everything. If you think you know everything, you're wrong. So what I get out of this is I get to find things I don't know, and I try and bring back those little clinical pearls to our shop.
It's so true. The smarter we get, the more you realize you don't know. So there's just so much to learn. Now, speaking of learning, wow, this is great. So tell us the first book of Aesthetic Microcannula. Wonderful. Tell us about this book. This is great.
Well, if you look here,
beautifully put together.
Well, thank you. First of all, if you look at the cover, that's me, and that's my patient. My patient was the lead showgirl for Jubilee in Vegas, and the reason I picked her was, it's not the usual medical textbook. You look at it, I go, whoa, what's this, right? And so, but she's my patient, so of course we used her. And if you look through...
Do they put you in the Jubilee show too? No, I'm just kidding.
Well, I was right next to you. Weren't you in the black leotards? That was you.
We were there together, that's right.
I was in the pink leotards.
Okay.
So you look through, we have different techniques.
Very nice.
What you can do. And here's where this book came
What
from.
a great book.
Now here's a before and after of a patient. See the difference?
So you can see before and afters, you can see technique, you can see mapping. So this is a resource. How do they get a hold of this book?
Well, here's the thing. What happened is when microcannula came out, the first thing I did was, okay, let me get all the books on it, and then I want to study it so I can be any good at it. So I looked around, and I couldn't find anything. Nobody had written the book on aesthetic microcannula. So I said, well,
we have one now.
I said, well, I've written articles, I published in Metastaetics, and I published in Prime magazine in Europe. Yeah, and so I said, well, what the heck? I'll write a book. So, but what I did was I didn't want prosaic, boring book. I wanted something that clinicians can use.
Yes.
You can look at the pictures.
It's practical.
And it doesn't have millions of words. And then you can look at it and say, well, I can try that technique. That makes sense to me. If instead of injecting in one direction, if I'm cross-hatching it, I get a better result. It's smoother, and I think it lasts longer. I think it looks much more natural for the patient. So we have different techniques that we're illustrating.
Wonderful.
Same ones we're teaching right here at the aesthetic show.
Because you're only one person. I mean, you can either come see him live, or you can get his book. And now, where can people find you online? Where's the best place they can find you? Do you have videos? What's the best way if people want to look you up and learn more?
Well, we're very lucky. This book here is on Amazon. Amazon picked this up. And it's on Amazon.com. If you do a search for microcannula, M-I-C-R-O-C-A-N-N-U-L-A, this will pop up because we're the only book, literally. And then, we're fortunate enough that we're actually on their bestseller list for a tiny little category called medical procedures.
Congratulations.
But this is a year later, we're still on the list.
Congratulations.
But I will tell you, to be upfront, it's not Harry Potter. We haven't sold millions of books. It's not that kind of bestseller.
One step at a time. So let me ask you this question. This is all very wonderful, and
sure.
I am inspired when I get to meet people like you and learn from you, and fun. You want to do more and be more, and so thank you so much for what you're doing. Where do you find your greatest challenges are now? You've achieved so much, you're teaching. Where do you feel the biggest challenges are for you, Dr. Lee?
Well, you know what I find fascinating? I find fascinating to try and find better ways of doing things. And to me, it's fun. You look at something and you go, well, that doesn't make any sense. If I pull back, it's crazy. Or we need to have something that people can follow, and I'm looking at it going, well, why hasn't anybody done something? And to me, it's a lot of fun trying to put together something that makes more sense.
Wonderful.
And it doesn't mean that what we do is automatically perfect up front, and so we have to adopt. But the challenge for me is actually learning new things. And now in our field, I do minimally invasive aesthetic medicine. Our website is LookYoungerMD.com.
LookYoungerMD.com. LookYoungerMD.com.
You can see everything out there.
Hi, Andrea.
And then hi, Joanne. Hi, Joanne.
Hello.
And so here's the thing. To me, it's so exciting when we can look at a new way of doing something and make it better for the patient. And then we have a chance at the show to present our ideas and our actual results. Now, I think the challenge for the future is going to be stem cells. Because right now I teach for Eclipse Aesthetic with PRP. But the future is looking, I don't know what you think, but I think it's going to be stem cells.
I like stem cell. It's very promising. It's still developed, so I'm excited about that as well. So another question for you. What is something that patients can do right now? People who are watching are saying, if I want to do something look better or do something for myself, what's something they can do right now?
Well, it depends on where you're coming from. And so, and what I would do is look in the mirror, and here's the thing. It's not what you or I see that bothers us. It's what you see as the patient.
Absolutely.
You look in the mirror, and something may bother you a lot, that we don't think is a big deal, but it bothers you. So the important thing to remember is when you're seeing any doctor doing cosmetic treatments, it's not what they want, it's actually what you want. And let them talk all they want, but forget about it. Any good doctor that does aesthetics, you have to go to what the patient wants. It starts with the patient.
It starts with what the patient wants.
So the first thing is look at yourself and say, what bothers me? And if something else doesn't bother you, and the doctor wants to do it on you, my position is don't do it. Why spend money in doing something that you don't want to do?
It's so true.
And so whatever bothers you should be the first thing. And then, our angle is doing minimally invasive. So basically, 99% of our patients walk in and walk out, and you don't have the surgery, you don't have the scarring, you don't have all the pain.
People don't want surgery
anesthesia.
today. They don't want surgery.
And so, my love is to do things where you can go back to work after you get something done, and you don't want to go to the OR. You don't want to take the chance where something happens, but you still want to look your best, and you don't want to take that kind of a risk. And now we have incredible technology that I never thought we could do this, where we can actually get very close to doing some of the things that could only have been done in surgery years ago. And the future is going to be in how you combine these minimally invasive techniques together. And right now, no one has that one formula. What is the best way of combining techniques, because there's so many techniques. So my challenge that I'm looking at here is, how do you put together the best combination to get the best result? And we're fortunate. We've gotten recognition in some awards, and you have too. That we both won the aesthetic award.
Yes.
And what kind of competition that is. There's his.
Here it is.
Now let me tell you, this is hard to get. There are some.
We're so proud.
There are some.
We're vying for another one this year.
I didn't enter this year. It's so incredibly hard to get that because now you're up against the best of the best of the best. And I know some very famous people that I think highly of that haven't won yet. So they ask me, how did you win? I go, well, I don't know.
it's this right here. See this? These magic hands. Look at these hands. So.
Well, yeah, but the competition for that is so intense, and so I'm proud to have colleagues that are able to perform at that level. Because I will tell you, not too many people can, and so. We all want to do our best, and I get a lot of joy in making our patients feel good about themselves. We go through life, and you can have the most horrible day, terrible things happen, and our chance is that you come in and I can make you feel better about how you look, and we've done that much to make the world a little bit better and to make you feel a little bit better. And in my mind, that's worth all the trouble that we go through.
Awesome. I love it.
Yeah.
I love it. What a humble man. Works so hard, achieves so much. I'm inspired. Thank you so much for doing our interview today. Before we wrap up, we have to do our proper selfie technique here. Well, we got one before, but we got to do one on camera where we flip this around. We got to turn the selfie light on.
Oh, you got a selfie light.
Oh, yes.
Okay.
Big smile, 1, 2, 3, cheese.
Okay.
Thank you so much. Wonderful. Dr. Lee, look him up. He's amazing. Thank you for joining us. We'll have more interviews soon. Thank you guys for joining. We'll see you soon. Bye.